good morning, and welcome to Dashboard Dissections Cosmetic Surgery Edition. Update, I got rubber bands on my braces, so if you see them, no you don't. My orthodontist says that wearing them while talking is really good and will help me get them off sooner. So here we are, Dr. Rice, we're wearing them and we're yapping, okay? Proof in the pudding right here. Never understood that saying, but there we go. So today, things that I was thinking about, literally, like my mind just kind of wandered to this. And I think sometimes like my mind just wanders based on like, I don't even know what, but sometimes I'll even like dream about things applicable to work. It's weird. Anyway, things I was thinking about recently was people's expectations after plastic and cosmetic surgery, elective surgery in general. Sometimes I have patients who come back to me as a follow-up and they say, wow, I was in a lot of pain. Or they'll even call after surgery and say, wow, this really hurts. Like that was a surprise. And I know, one thing that I know, and I know this from my own experience, but I also know that there was a study about this, and I don't recall where I found it or anything. But there was a study that basically shows that when you're only receiving like verbal information and you only receive it once and you're in a high stress environment, similar to like a doctor's appointment, people only retain on average 20 to 30% of the information that is said to them. So every single person that comes into my office, I anticipate that they will retain about 20 to 30% of what I'm saying, which is shocking, right? Like that's 1/5 of what I say. 1 out of every 5 statements they will actually remember. And I do the same thing. I mean, like I've mentioned it before, like when I go to the doctor, I have the same issues. So it doesn't really surprise me, but I guess it does a little bit still, considering I'm talking about it. Ooh, the ends of my hair do not look good. Okay, don't look. Let's fix that. Okay. So I'm always surprised by the people that call a couple of days after their surgery and say, wow, I'm in a lot of pain. Well, yes, I cut you open and shoved a foreign object into your chest. Yeah, that hurts. Sometimes I cut through some muscle in order to do that. And that stretch is really painful. And I try to prep people for that. I will say breast surgery is not usually as painful as other surgeries. Liposuction tends to be a really painful surgery in any location, but especially the area up by the ribs. And then tummy tucks and brachioplasties, which is excess skin removal of the arm. Those tend to be my more painful surgeries in general. Now, caveat, I don't do a ton of thigh surgery, thigh lifts. I do it, but it's not a common part of my practice. I do more breast, chest, lipo, body contouring, tummy tucks, stuff like that. So, breast surgery is usually not the more painful one. Especially, shockingly, a lift is usually less painful than breast implants. And I think that's just because there's not as much stretch. It's more just incisional pain than anything else. But anyway, like I said, I think things that surprise me about patients is that number one, they don't expect it to hurt, no matter what I say, because it's elective. And again, this is not everyone. It's not everyone. I'm just having some generalized thoughts. Okay, so if you want to get technical, right, none of this is every single person, right? This is just things that surprise me that still happen regularly, but not all the time. I'm also very surprised by people who think that plastic surgery, cosmetic surgery is a magic wand. It's not. Trust me, I wish it was. And also trust me in that I measure everything at least 6 or 7 times. You know that whole saying that's like measure twice, cut once? I measure about 7 or 8 times and cut once, right? Because I get it. It's your body. You have to live in it. No matter how many surgeries I do in that day, it doesn't matter, because it's your only body, right? So I take it very seriously. However, the body will heal the way it heals, and especially surgeries that take longer, like in the 2 to 4 hour range, swelling starts to occur while you're on the table. Your body moves in your day-to-day life, and I'm operating on you on a flat table. Now, granted, I can move that table and look at things, and I do that, but it's not the same as your posture and the way that you stand and the way that you carry yourself, the way you hold your arms, whatever. It's not the same. So it is not a magic wand. The results will never be perfect, and especially with the breasts, I always say they're sisters, not twins. They're never going to be completely symmetrical. Even if my measurements are perfect, you're sitting perfectly on the table, and everything goes perfectly, your body still tends to heal in a way that, like, your slight asymmetries come back. I've found that patients who have, like, almost everyone has a little bit of nipple asymmetry. Almost everyone. I would go as far as to say everyone. Everyone has some asymmetry about either their nipple or the colored portion around the nipple. Okay, and those slight asymmetries tend to show back up that same kind of, okay, this one points a little more out, this one points a little more down. Those things tend to kind of come back. Like, the body wants those asymmetries. I know it sounds weird, but I've seen it. I see it happen all the time. So that's the second thing that kind of surprised me. Number one, they expect it to be pain-free. Number two, it's expected that surgery is a magical wand, a perfect fix. And again, you know, this is not everyone. This is a few that continue to surprise me. I think the other thing that sort of surprises me is no matter how much I say, you know, this is going to take time to heal, you are going to be swollen, this is not how things are going to look when things are all said and done and everything is healed up, that message still doesn't always get through. People still think that the way things look right after surgery is the way they're going to look, no matter how many times I say that's not the case. So I try to preface it as much as I can, but again, a lot of what I do changes based on what I find in the operating room, especially revision cases. Oh man, let's talk about revisions. Revisions are tough. They're very hard, and I work very, very hard to give my patients a reasonable expectation of what I can and cannot do with each specific surgery. And people ask me constantly. The other thing that surprises me, the last thing that really surprises me about patients with cosmetic elective surgery, aesthetic surgery, is that patients ask me every single time, what do you think? What do you think I need? What do you think looks good on my body? While I'm happy to give you my opinion, I always tell my patients, it doesn't matter what I think. It doesn't matter what I like. It doesn't matter if I like the way that looks. It doesn't matter. It shouldn't matter to you what other people think. It should matter what you think. I always tell my patients, this is what you want. You have to live in it. You have to carry these implants. If you like it, I love it. If you're happy with the result, I'm thrilled. That's my entire purpose and goal. Now again, I'm happy to give you my opinion and say, this might be a little large for your frame, or this is not going to look quite as natural as maybe your goal photos that you've shown me, right? Like, this is different than what you showed me. This is different than the words that you're saying. A lot of women will come in saying that they want a very natural appearance to their breast, and then they'll pick a 600 or 700 cc implant, which on some women can be a natural look, right? But on others, you're never going to get a natural appearing look. Like on someone who's short, petite, that size implant is never going to look natural. And so I will say that. I will say, you came in asking for a natural look. This size is going to be very difficult to look natural on your frame. Like, look back at your photos, really hold this weight, see how that feels. Is this really the vibe that you're going for, right? I do try to give that kind of input because it is important. And I think a lot of women get nervous sometimes, and men too, but more women is what I deal with because I do a lot of breast surgery. But I think women get nervous to say that they want that fake look. Some women don't, and I appreciate that. If that's what you want, I want to give you what you want. I don't need you to tell me what you think I want to hear, right? Like, if you want to look like Barbie or Dolly Parton, I do not care. I will make you look that way if that is what you want. But there are a lot of women that think that saying, oh, I want a natural look is just sort of expected. And if that's really what you want, great. We will get there. But if that's not really what you want, don't feel obligated to say that. You're not obligated to anyone at all. You're not obligated to explain your choice to anyone. And especially to me. I'm just here to use my skills to show you what I can give you and to tell you the risk of what you're doing. And then your job as the patient is to tell me, no, Dr. Alley, that is too much risk for this benefit. What are other options? Or, yes, that risk is worth it. This is what I want to do. That's the entire point of my consult, is to tell you what I can do technically, what surgery is needed to get you where you're telling me you want to go, the best way to get there. And sometimes we need to stage things in order to make your goal realistic. Sometimes we need to talk about medical assisted weight loss before we can do surgery safely. So there's a lot of things that I do discuss. Sometimes we need to quit smoking. We talked a little bit about smoking and how important it is to quit before any surgery, but especially in elective surgery, and extra especially in elective surgery with a big incision. So there are a lot of things that we discuss that are part of that decision for the patient. So things that I think are important to do before you go for a consultation. Number one, I think it's really important that you have a clear idea of your goal. Pictures are great. 20 pictures, not great. 3 to 5, perfect. Give me a good idea of what you like. Really think about what you want things to look like and what things are similar to your body frame, right? It's always a difficult thing to bring up to someone to say, this patient's body type and your body type are different. So tell me what you like about this, because some of these portions are not going to be changing, right? So really think about your body type. And a lot of people, myself included, our Instagram has gotten better about including that information about the patient, because it is hard to tell, especially like when you're just looking at their breast and you can't really see their body shape, their, how broad their shoulders are, how big their rib cage is. It's difficult to kind of put all that information together. So really looking at that. And then the other things to do before your consult. Number one, be really clear about your goals and expectations. Number two, do your research on where you're going. I recently had a patient come in who had 2 breast surgeries, implants only, and she said that she had looked for Nashville's best breast surgeon and found this doctor in a magazine as Nashville's best breast surgeon. Now, unfortunately, a lot of those things can be purchased. Being on those lists is something, I get emails for it constantly, okay? You get an email that says, oh, someone's nominated you. No, they haven't, right? Maybe they have, okay? That was negative. Maybe they have. But someone's nominated you for this list. Make a donation to the magazine and get added, get this page spread, get a half a page spread, get whatever. You pay to be part of those. So that's a common way that people get included in those lists, is paying for it. Some, not all, but a majority of them. There's also a lot that can kind of be affected. I think the best way to go about finding your doctor is if you know a friend who had a good experience. Google reviews are a pretty good way. I know there are some ways to kind of fudge that, but I think Google reviews are a good way to go about things. But I think a big key is other people's experiences. And a lot of people, women especially, some men too. Actually, I have a great guy who was on our Instagram. He's amazing. He sent me a couple people, super open about his journey and his use of cosmetic surgery in addition to his gym routine and his weight management lifestyle. So he's been great. But women too are very open about experiences, especially really good or really bad experiences. And I will say, take a bad experience with a grain of salt, right? And I understand that saying that as the doctor maybe has a little bit of, bias, but there are some things that doctors do that are not good. We make mistakes. We are human beings. That is not out of the question. I will say there's usually, like every argument, like my therapist tells me, in every argument, there are two people involved, there's two people at fault, right? There's always something each party could have done better. And hindsight is always 20/20, right? I hate those idioms, but they are so freaking true. So there is almost always a component that is caused by each party, by the doctor, by the patient. So if you know that this person you're talking to is a prior smoker and they had wound healing complications, that's probably partially on the doctor for maybe doing the surgery when maybe they shouldn't have, or not explaining to the patient the importance of staying away from nicotine, and partially on the patient for doing what they shouldn't be doing, right? So there's always two sides. So take both super positive and super negative experience with a grain of salt, because there are a lot of factors that make some patients a better candidate than others for certain surgeries. So this last bit is 100% and totally my bias. So, just take it all with a grain of salt, right? But the Facebook groups, especially here in the Nashville area, I will discuss what I know, and that is the Nashville area. A lot of them have internal bias, okay? And I'm going to speak very carefully, because no one is doing anything wrong, right? No one is doing anything illegal. No one is doing anything like that. However, I would just caution people, just like in statistics, just like in studies, there are biases that human beings have, and that's of no fault to them. That is just simply them, right? But a lot of the Facebook groups in Nashville have some bias within the administration, and that's okay. They are human beings. They can have their opinions. That is 100% fine. There is no problem whatsoever. But there are some biases there. So just be careful and do your research, right? Multiple sources is better than one, right? And when in doubt, get your own information, right? Go to the source. I will say a majority of cosmetic surgeons, maybe not, actually, I don't know this for a fact, but from about 2 years ago, when I was more in tune with everything going on, because I was training and I was I was gauging where to work, and I was kind of shopping around, not really shopping around, that sounds bad, but I was looking around at where would be the best place for me to work. A lot of places will offer a complimentary consultation. So you don't lose anything other than time by going, meeting the doctor, seeing the facility, asking your questions, and seeing how you feel. I think a lot of the reason that patients come back to me and patients refer other people to me is because they feel comfortable. And I've said multiple times, I think that is extremely important. You should feel safe and comfortable to express your opinion and your doubts and your concerns and your questions to your doctor or your injector or your esthetician. It shouldn't be difficult to talk to them, right? Because if you're able to do that when things are going good, great. But it's really hard to do that when things are not going good. And so you want to make sure that you feel comfortable, that the staff makes you feel okay, that you feel supported. So I guess my conclusion will be, when you go in for a consultation, number one, try and listen, take notes when you need to, write your questions down, bring in inspiration pictures, have a clear idea of what you want, and be able to verbalize that. Number two, I did a bad job of numbering this. Okay, so number one was like 8 things, right? But have clear goals, have your questions written down, bring a second set of ears if that's important for you. Bring someone who's going to take care of you during the recovery process, because I go over the recovery in your consultation. Ask your questions, write down the answers if you need to. Try and remember as much as you can of what I say, or ask. We're happy to answer those questions again. It's no problem whatsoever. And then I think realize that whatever the doctor is telling you is trying to set you up with a realistic expectation of what is a good goal, of what can be done surgically and what cannot. Also understand that if I am doing something or recommending something, it is either to protect your safety or to get you to your goal. Wow, almost lost the phone there. So my most important, my biggest priority, number one, is that you're safe. Number one, I tell patients this all the time. I would rather you get up off that OR table, not having had your surgery, and yell at me about it than die, right? I know that's extreme. I know that's a little morbid, but it's true. I would rather you be mad at me for not doing your surgery and still be here with your family and your friends, still be able to talk, God forbid these are terrible things that could happen, but I would rather that. Right? But your safety is number one. And then secondly is that you get to your goal and you achieve what you're trying to achieve with surgery. Number three is that you love it, right? Like, that's super important to me. Again, it doesn't matter what I like. If you love it, I'm thrilled. That's all that matters. So I got off on a crazy tangent here, but basically and everyone always asks me, Allie, how did you decide on where you wanted to go for residency? How did you make your rank list? How did you decide where you wanted to go for fellowship, for your job, for whatever? And I'm probably not a good person to ask, because I really and truly go very much on how I feel, how the people that are there make me feel during the interview process, during working with them, whatever. I pretty much go on that. I didn't have a list of pros and cons. I didn't remember which place was going to have night float versus a 24-hour call shift. Those things were not as important to me as the people that I was working with and the way that they made me feel. Do I feel comfortable? Do I feel safe to report an issue? Do I feel like the people around me will help me grow, will help me learn, right? Those were the important things to me. So I almost always, for every big decision, every big list, of course my husband had input and geography had some input, mainly for his job, but and for his, life and what he wants, right? But really and truly, for me, the most important thing is my growth and my comfort to grow, right? So you need to find what's most important for you. For me, that's how I feel. So I go off of how everyone makes me feel when I'm doing things. So during a consult, if something doesn't feel right, trust that. Trust yourself. Because if something doesn't feel right, then imagine how much worse it would be if something went wrong and you had that feeling. Right? So trust yourself. You're smarter than even you think you are. Winnie the Pooh said it best. Okay? You're smarter than you seem, or you're smarter than you think, and stronger than you seem, braver than you seem. I don't know. I love that quote though, and I just butchered it, so I'm really upset with myself right now. But anyway, yeah, go on your feelings. Feel what you feel and trust that. Then I would secondly go on, what information was provided. Did you feel like safety, your safety and your goals was a priority as the patient? I would want my safety and my goal to be number one. If you go in and the doctor says, don't you worry, honey, you don't have to try on sizes, I'll make you look good, that would make me uncomfortable. That would make me uncomfortable. Like, sir or ma'am, you don't know what I want. You don't know what I like. I don't want to look like what you want me to look like. I want to look like what I want to look like, right? So that would be important thing number 2. And number 3, price, of course, is going to be important. Obviously, you don't want to pay way too much for a surgery, but you also, you don't want to find the bargain, right? That's not always a good thing when it comes to surgery. So I guess all that to say, come for a consultation and go for consultations, because a lot of times they're complimentary. And again, the thing you lose is your time, which is very valuable. Don't get me started on that, but it is very valuable. And a lot of places can do consults in various ways. We offer email consultations, which we call an online consultation, a virtual consultation where, we're just on basically Skype, in-person consultations at all 4 of my offices. So there's lots of variability and there's lots of ways to get the information that you want and need, and it's all complimentary. So just do whatever you need to feel the most comfortable with your decision and get all the information you want. I always tell people, don't ever feel like you're bothering me or my staff by asking your questions. We do this every single day in, day out. We do it. And it's routine to us, but it's very, very not routine for you. And we understand that, right? I always try to tell my staff, I try to think of myself at the auto dealership, right? I don't know anything when I go to the auto dealership. I don't know anything. I don't know why my car makes that funny noise. I didn't know that was normal. I didn't know that my freaking traction control was the sound that things make when I go over a hefty bump. Okay, I'm not that bright with my car. Okay, she's great, but I don't know much about how it runs or how it functions. Everything with this car is new to me, whereas it's routine and everyday for the mechanic, right? So it's the same thing. So I try to think of myself at the auto body shop, the way I would want to be treated, even though I know my questions are stupid. Not saying that patients' questions are stupid, but I know sometimes that I don't understand. And the grace that they give me, the level of explanation that they give me makes me more comfortable. And I appreciate that, right? Even though it's routine and day in, day out, everyday life for them. It's not for me. It's new for me. So we try to do the same thing for the patients because, like I said, while we know, and I know that I do this every single day, you don't. You don't. And if you ever feel treated that way, like you should know or this is stupid, that's a red flag, in my opinion. That's a red flag. You shouldn't be made to feel that way because this is a huge deal. It's still surgery. I started this whole thing by saying it's still surgery. There are still risks. It will still hurt, right? So you should still be treated with respect, and all of your questions should be answered with respect. So I guess from there, I will just say, come see me if you have questions. Call, email. Like I said, you can do it a multitude of ways. We're accommodating. We want to see you. We want to help you live your best self and be the most comfortable you can in your own skin, whatever way that takes, whatever goal that is, that's what we're here to do. And, you know, I just had a follow-up with a patient who I did a really hard surgery on. It was extremely difficult because we were only working on one side. She unfortunately had a pretty significant breast asymmetry. One side was probably a B cup, which I hate measuring things in cup sizes, but, you know, it's what we do. So one size was a B cup and was pretty perky. One size was about a D cup and was not very perky, had a lot more ptosis, which is the science word for sagging. And she did not want implants. She wanted only the one side affected to be made smaller and lifted. So we did a unilateral breast lift to try to match the other side. And technically, that is extremely challenging when you're not able to affect the other side. So when you're only working on one side and you're trying to match, it's extremely difficult technically. But I saw her in follow-up last week, a week ago, I don't remember. But she was extremely grateful. And she said to me, she said, I came to you because no other doctor, I felt, listened to what I wanted and gave me options that made sense for what I wanted. She said every single other doctor I spoke to wanted to put an implant in, and I didn't want an implant. And you were the only doctor that gave me even the option to not have an implant placed. Isn't that sad? It made me really sad for her. And she is a fantastic patient. She is so great. She is so grateful. And I was very clear with her that, you know, this is not going to be perfect. They are not going to be super symmetrical. We're going to try. But that expectation needs to be thrown out the window. They're going to be closer. I always say they're distant cousins right now, and we'll make them sisters, right? Like, that's as close as we can get them. And she was so grateful. And just her saying that made me realize that it's not a given that your doctor will listen to you and understand and give you something that makes sense for your life. But don't stop searching for that, because that's what you deserve. You deserve to get what you want. You deserve to be heard. So find the doctor that'll do that for you. And I hope it's me, because that's what I strive to do for every single patient. But if it's not, sometimes it's just not a right fit, and that's okay too. Okay, I'm going to get off my soapbox now. I'm almost to work. I didn't anticipate talking about all this. I kind of was just going to start by saying like do's and don'ts of when you come in for a consult. But, you know, here we are on my soapbox talking about, you know, feeling comfortable and feeling heard. My therapist would be so proud. So I will see you all next week. And if you have questions, reach out. I'm always here, like I said. Multiple options for a consultation. And, you know, I'll talk soon. See y'all later next week. Bye.